Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Today's show sponsor, Care First Specialty Pharmacy. They are leading compounders of LDN and other custom treatments servicing patients in over 18 states coast to coast. They are widely accredited to provide you with the highest quality demanded by the industry and the expert service you expect. To learn more, call 844-822-7379 or visit cfspharmacy.com. The LDN Research Trust's Facebook group has almost 18,000 members around the world. It is a great place to start your research and connect with others. www.facebook.com/groups/LDNRT. It is a closed group and only members can see your post. Nothing is shown on your page or feeds. Posts can't be shared. We do also have a page where you can share links. It's www.facebook.com/LDNRT. Check out our books, conference pages by searching on Facebook. The LDN Research Trust also has a Twitter account, and you can find us on twitter.com/LDNRTrust. The LDN 2017 conference will be held in Portland, Oregon in the US, 22nd to the 24th of September. If you are unable to attend in person, we'll bring the conference to you, regardless where you live. You can participate via our live stream. Check out www.ldn2017.com for early bird discounts. The conference will examine life-changing breakthroughs for treating multiple sclerosis, Crohn's disease, colitis, autism, irritable bowel syndrome, lupus, fibromyalgia, rheumatoid arthritis, chronic pain, mental health issues, restless leg syndrome, and many other conditions using low-dose Naltrexone. For tickets, live stream, and sponsorship opportunities, go to www.ldn2017.com. Today we're joined by Dr. Kat Toups, who's an MD from California in the US. She's a functional medicine doctor and a psychiatrist. Thank you for joining us today.
Hi, Linda. Thanks so much for having me.
Well, this is really exciting. Before we start, perhaps you could give us some background of why you got into medicine in the first place.
Why did I get into medicine? Well, that's been a path. I actually was studying physical and evolutionary genetics way back when we didn't know anything about genetics. And I got interested in medical genetics, and I was in graduate school, and one of my mentors suggested I would do better by going to medical school. I would have access to working with people to pursue the research I wanted to do at that time. And so that's how I ended up shifting gears and going to medical school. I'd say in the first year there, it became clear to me that psychiatry was my passion. I loved working with people with psychiatric disorders, and so at that point, I kind of abandoned the research aspirations and became a clinician. Later, I think when I finished my residency training, I ended up working as a professor at UC Davis for a couple of years, and left academics for various reasons and then ended up back in the research field. I started doing clinical trials, and I ran a clinical trials research center for about 12 years. I probably did over 100 different clinical trials with all kinds of different medications, many of the medications that are out on the market right now for psychiatric disorders and fibromyalgia and sleep apnea and narcolepsy, all kinds of different areas. And I kept hoping that each new medication was going to help the suffering of my patients. And I would get excited. Every new mechanism of action, okay, here's something new. This is going to help. But what I came to see was the answer really wasn't in a pill, that the kind of illnesses that my patients had could not be fixed just by giving them a medication, that they were multifactorial reasons, and that the pharmaceutical route was not the answer. Maybe some of the medications did help relieve suffering for people, but they didn't solve the problem of why they were sick. So, like many people that have come to the functional medicine table, I came into it with my own illness. I had immune problems sort of on and off most of my adult life, and finally crashed and burned with some serious immune illness. And of course, as a physician, I knew the limitations of what traditional medicine had to offer me. They could give me steroids to suppress my illness, but that wouldn't cure things. And so I started learning functional medicine at that time, and I suspect a lot of your listeners are familiar with functional medicine, but the basic idea of functional medicine is that we want to understand the root cause of why someone is ill, and it's usually causes, plural, because it really is never any one thing. And then as we address all of those factors and bring those things into balance, we can restore health and get people well instead of just leaving them with a chronic illness that they have to be treated for life. So I started on the functional medicine path, I would say, about 2009, and went through all the various training courses with the Institute for Functional Medicine and subsequently became certified there, and started, as I recovered my health, there was no turning back. Once you know functional medicine, you just can't go back to traditional medicine when you have this tool to really, really help people get well. So that's how I started my functional practice. The kind of patients that I treat in my functional practice, I would say a large majority of people have immune-type illnesses or infection-type illnesses. So many with, chronic fatigue and then of course all kinds of mood symptoms that go along with immune illness. So my patients kind of have the double whammy. They have the immune illnesses and they're having a brain component, either psychiatric or cognitive problems or both. So I would say that I've ended up with a pretty complex set of patients, and I really enjoy working with very sick people because it's so much fun to help them on that path to getting better and getting their health back when many doctors have told them, you're just going to be sick for life. You're going to have to take medication for life. And I never buy into that.
Mm-hmm. So just out of curiosity, before I let you carry on, when somebody comes to you with all these complex conditions and symptoms, how do you go about finding out what the root cause is? Is it just a series of blood tests?
Right. Well, certainly blood testing is an important component. I mean, the first thing that I look at is a timeline. So I have patients fill out quite detailed questionnaires that I can start to see what has been happening. So I start back with when your mother was pregnant. Did anything happen? Did she have illnesses? Was she under a lot of stress? What happened at the delivery? Was it a vaginal birth? Did you have a C-section? We know that people who are born by C-section and subsequently people who are not breastfed may have lower levels of healthy probiotics than people who had a vaginal delivery and were breastfed, because those are the mechanisms where we are inoculated with our first big doses of probiotics. Actually, some newer data is showing that we probably do pick up some probiotics in utero, but the big inoculation that we get is in the early weeks and months of our lives. So those kind of things are factors for people. When I have people that were hospitalized early in infancy, you can imagine if people are hospitalized that they're probably getting pumped with antibiotics. And so early antibiotics, these are all factors that will contribute to immune disorder down the road, because we know that the gut microbiome and our healthy probiotics are what control our immune system in great part. So if we don't have a healthy gut microbiome, then we can predict problems with chronic illness down the road. So then I'll look at the factors all through their life. What happened in early childhood? Did you have ear infections? Did you have allergies? Did you have colic? And then I'll look at the stressors happening in all those various factors. What were your teenage years like? Was it, pleasant, or was it a time of struggle and conflict? And what was happening in your family? Was it a high conflict-laden situation? Was somebody a drinker? Was somebody impaired by psychiatric disorders? Did a parent die or abandon the family? Because all of those early factors we're learning now, they're called adverse childhood experiences. And we know now that when people have a lot of those factors, we can see immune disorders developing at higher rates, like 20 or 30 years later. So, the notion of PTSD, post-traumatic stress disorder, you don't have to be beaten or raped or, some of the bigger factors that we think of with PTSD, but there can be all kinds of levels of trauma and stress that then are contributing. So I'll look at both the emotional factors growing up, and of course I'll look at all of the physical clues that might tell me how did they get to this state that I'm seeing them in now as my patient. So I'll create a timeline and look at factors. I'll look at the toxin exposures that they've had. I'll ask about tick bites. I'll ask about mold exposure. Those are, of course, things that can affect the brain and the immune system. So taking a good history gives me a lot of clues as to what's going on with people. And then you asked about testing, and of course, testing is a big part of what I do. And in functional medicine, sometimes we're accused of testing too much. But I think when you're faced with people with really complex illness, you have to just throw out a wide net and reel it in and try to see what comes back. And so by testing a variety of factors, things will turn up that people will say, well, why didn't my doctor find that? Well, your doctor didn't test for that. I'm sorry they didn't test for that, but here it is, and now we have a clear treatment target because we found it by testing all the various factors. So definitely the testing for me is another important component.
Mm-hmm. And what other tests other than blood tests do you carry out? Do you do, for example, breath tests for SIBO?
SIBO. Well, SIBO is how I first learned about LDN, actually, and years back, attending the SIBO conference. And for people who don't know, SIBO means small intestinal bacterial overgrowth. And people who suffer from SIBO have a lot of GI issues. They typically have a lot of bloating and a lot of gas, and people can have a lot of irritable bowel syndromes, either constipation or diarrhea or both. And what happens with SIBO is we have a lot of bacteria in our colon, and that is normal, but we shouldn't have such a high level in our small intestine. But when the bacteria get out of balance, they can grow into the small intestine and overtake that. And so when you eat certain foods that are fuel for those bacteria, they'll just have a little party with all that food, and they give off gas and bloating. And some people can appear 6 or 7 months pregnant with the magnitude of the bloating with the SIBO. And so, and just as a digression as a psychiatrist, it's very clear when people have SIBO, and the gut symptoms, that communicates directly with their brain. So we have the gut-brain axis, and whenever there's disruption in the gut, that causes what we fondly call leaky gut, or increased permeability in your gut, and that allows, first off, food particles to get through into our bloodstream, and then sometimes bacterial or viral or parasite components, and all those things activate our immune system. It's supposed to turn on when things get into our bloodstream, the invaders. And so when that immune system gets activated, it releases these inflammatory chemicals called cytokines to kill those invaders. And those inflammatory cytokines don't just stay in the blood next to the gut, but they'll travel around, and they freely cross the blood-brain barrier, and they turn on the immune system in the brain. And when there's these inflammatory cytokines turned on in our brain, it causes psychiatric symptoms. And kind of the first thing that I'll see is anxiety. Sometimes people that develop immune disorders, they haven't been anxious all their life, but boy, it'll get turned on when you're having immune problems or SIBO problems. And then it can have depression ramifications. It can have cognitive ramifications. And then even people who never had ADD can have ADD symptoms with, trouble paying attention and being distractible and can't focus. So I digressed a little bit, but SIBO is where I learned about LDN and had never heard of it before in any way, shape, or form. But as part of the regimen for SIBO treatment, LDN is used theoretically as a prokinetic agent. And so the thinking with SIBO is that you probably have some kind of GI infection. Your immune system turns on to fight that infection, and then somehow the immune system either stays activated or is attacking a component of your digestion that directs the peristalsis, the movement of your gut, called the migratory motor complexes. And so the thinking with LDN is that it somehow settles down that immune reaction and supports the migratory motor complexes to kind of wake up and function more properly so that people can quit suffering from constipation or diarrhea. So that's where I first learned about LDN. And of course, from that point on, particularly from the LDN Research Trust, I think I found you guys next and went to one of your conferences. And that's when it really broadened my appreciation of all of the various uses that I now use LDN for with my patients. So I can't remember the beginning of your question anymore, but that answered some of it.
Okay. Well, we'll just have a quick break and we'll be back in just a minute. To listen to individual radio shows and interviews, go to www.mixcloud.com/LDNRT. I'll repeat that. It's www.mixcloud.com/LDNRT. Today's show sponsor, Care First Specialty Pharmacy. They are leading compounders of LDN and other custom treatments servicing patients in over 18 states coast to coast. They are widely accredited to provide you with the highest quality demanded by the industry and the expert service you expect. To learn more, call 844-822-7379 or visit cfspharmacy.com. The LDN Research Trust is very proud of the LDN book, which was launched at the LDN 2016 conference in Orlando and has been a great success, not only for the medical profession, but for the patients wanting to learn more about low-dose Naltrexone. Full details can be found on the homepage of the LDN Research Trust. Discounts are available on bulk orders of the book, which is 10 or more. For details, email me, linda@ldnrt.org, telling me how many copies you wish and where you live. I will then be able to get Chelsea Green Publishing to contact you. 2017 special offer from Chelsea Green Publishing. Free shipping for US non-bookstore retailers on orders of 25 books or more. For full details, email me, linda@ldnrt.org. Welcome back. Okay, what I would like you to do now, Kat, is could you give us an example of some of the patients that you've treated?
Oh, sure. Gosh, there's been so many, and I would say I use LDN in a variety of situations. It's been probably best studied with immune disorders and with cancer, and so that's probably the scenarios that I first started using LDN beyond the SIBO implications. With cancer is really kind of the ultimate failure of your immune system. And so this is, to me, why LDN use with cancer is kind of a no-brainer. I feel like anybody who has cancer or anybody who has had cancer, if you've ever had cancer, it means that the symptoms all came together for your immune system not to notice when your cells mutated or started to overgrow and become cancerous. So cancer is certainly one place that I have used it, and I actually work with one of my nieces who has a carcinoid tumor that has metastasized to her liver. And when I first started working with her, I definitely put her on LDN right away, and at that time her tumor markers had been gradually and slowly increasing over a couple of years. Carcinoid, fortunately, is a slow-growing tumor, but obviously in her case it was spreading. And I would say, we certainly did other things, nutritionally to support what was happening with her health and working with her diet and her stress. But I think the LDN was a big part in her case because now it's been maybe 2.5, 3 years, and those tumor markers have definitely come down, and they stopped that upward march that I saw once I had gotten her records. So I would say that's a, good example of one of my cancer uses. With the immune uses, I use it for all kinds of immune problems. It doesn't work for everybody. There's nothing that works for everybody, but to me it's kind of a no-brainer to try it because it's extremely well tolerated as far as side effects, and it's inexpensive. And it's not a burden as far as drug interactions. The only drugs it interacts with really are narcotics, because the LDN is temporarily blocking your opiate receptors where narcotics act. If you use narcotics while you were taking the LDN, it wouldn't hurt you. They wouldn't work if you had just taken your LDN dose. But other than that, it's pretty simple to use as far as drug interactions. So I think it's something that I always recommend my immune patients to consider trying. And I've used it for Hashimoto's thyroiditis, unfortunately a condition we're seeing so much more of these days with probably from toxins and maybe fluorination that displaces the iodine from the thyroid. But we're seeing a lot of Hashimoto's that I never saw earlier in my medical career. And with Hashimoto's, for some people, it can help the Hashimoto's so quickly that I always warn my patients that are on thyroid medication, if they start feeling hyperthyroid, like they're on too much medication, you can feel jittery or heart racing when you're on too much thyroid medication. I advise them to let me know immediately, and I give them a lab order to get their thyroid tests right away, because what I find is for some people, they can reduce their thyroid meds because of treating with the LDN. And I've had people that have, completely resolved their thyroid antibodies And again, that's not the only thing I do. I always work with the diet and the nutrients and, other immune support, but I definitely know that to be a factor. I've used it for psoriasis, and I started taking LDN myself because I have psoriasis, and I would say within days I stopped needing to use topical steroids on my scalp, which is where I have the worst symptoms. So I think I had another patient who told me within days her psoriasis started to improve, and she had more classic, more severe psoriasis with plaques on her elbows and knees, and now I can see the skin pink and clearing, but the lesions are all gone there. I've used it with my multiple sclerosis patients. I've used it with Parkinson's patients. I've used it with one of my patients that has multi-system atrophy, so some kind of immune disorder, first attacking the cerebellum and now attacking other parts of her brain. I've used it with a lot of fibromyalgia patients, and fibromyalgia is one area where people say you should watch the side effects of LDN, that sometimes it might flare it up in the beginning and you might have to start lower and go slower, and I really haven't seen much of that. I usually let my fibromyalgia patients know that that's been reported, and but I still go ahead and start with my standard dose titration, and I haven't really seen any big problems with them tolerating the side effects. I use it for pain conditions. We know that when you take a dose of LDN, that it's reported to, it temporarily blocks your own opiate receptors, and that causes your own brain to make opiates. So your brain goes to check in and read how much opiates you have, and it says, oh my God, we don't have any opiates today, we better make more. So your own brain is reported to make 6 times more opiates with a dose of LDN. And opiates, of course, are our feel-good hormones, and that is also the component of narcotics that helps pain. So LDN can be quite useful for pain conditions, and I've in conversations when I first learned about it, I was active on a lot of the LDN Facebook groups where I could read patients' stories and hear what they were experiencing. And I know I spoke with one woman there who told me she had been on high doses of narcotics for many years for regional complex, regional complex sympathetic, blanking on the name of it at the moment, but it's a neurologic pain disorder that can be quite disabling. And she told me that by using LDN, she was able to get off of her high doses of narcotics because it had controlled her pain so well. So I'd say that's one area I use it for. I use it for psychiatric symptoms. So I am a psychiatrist by training, and I do general functional medicine now, but of course many of my patients do suffer from psychiatric symptoms. And when I first learned about LDN, I thought, okay, we're giving somebody something that's causing their brain to make more opiates, and what is that going to do for psychiatric symptoms? Well, it does do things for psychiatric symptoms. Being our feel-good hormone, I've seen it really help people's depression and anxiety. And the first time I saw so clearly that happened, I had given it to a young woman who was very inflamed, and we could not figure out the source of what was triggering her. But I thought, well, let's just try this and see if it might help, that maybe there's some immune diathesis that's triggering her immune system and causing all this inflammation. So I started her on LDN. She came back 5 weeks later and told me a very stressful story about how she'd had an asbestos leak with her heater, and that everyone in the family had been exposed. Her 2 toddlers, they had to move out of the house. It was all of this drama, and I was getting so stressed hearing this story. And she got a smile on her face, and she said, but my depression and my anxiety are gone. And my jaw fell open. I said, what? And she said, it's the LDN. She said, it took away my depression and my anxiety. So even in the face of these tremendous stressors that she had to cope with, it resolved her symptoms. So that was my first big eye-opener that, wow, this really is having some beautiful effects for some people. So I have used it with a variety of people for psychiatric syndromes, and I changed my strategy after last year's LDN Research Trust Conference. There were two psychologists there that both presented some data working with veterans with PTSD or post-traumatic stress disorder. And they were giving the veterans the LDN in the daytime. And typically we've given it at nighttime because that's the time when you're sleeping that your brain reportedly makes a lot of opiates. So we're giving it that boost by triggering a bigger response at nighttime. But we know that it does work when we give it to people in the daytime, because some people can't tolerate it at night. The biggest and most common side effect is that it can cause very intense dreams in the beginning. And I always tell people, the dreams are not nightmares. They're kind of hallucinogenic, kind of trippy dreams. So they're not necessarily scary, but some people find that because of the intense dreaming, it will wake them up. And usually that passes after a week to 10 days is what I notice for most people. But some people end up moving the medication to the daytime because of that side effect, and we know that it can still work in that regard. So the psychologists were thinking, okay, why don't we give this a couple times during the day to see if we can get that endorphin increase during the day when these patients are really stressed and triggered by the PTSD symptoms. So they started splitting the dose and giving half of the target dose in the morning and half in the late afternoon so that people could have that more pronounced opiate effect during the daytime. And they had some very lovely results with that. So since I learned that, I have shifted a lot of my patients who do have anxiety or PTSD symptoms to taking it in the daytime. And I tell them, look, if you forget your afternoon dose, no problem. Just take it in the nighttime. You just get it in. It's not that precise that you need to take it at a particular time. But I've definitely seen some nice results for people with the mood disorders. So that's been an exciting target. Can
I just ask, for the psychiatric patients that you treat, how long would you say roughly it is before they notice any improvements?
I would say it's kind of insidious. That one patient I mentioned with the asbestos exposure, I had seen her 5 weeks after she started, and she seemed to notice it within a few weeks' time. With the immune disorders, as I mentioned, sometimes people can see responses almost immediately, and other times it's a slower response. So typically the teaching has been, and what I do is that I'll tell people, we're going to try this for 3 months. And if we don't feel like there's any obvious benefit after 3 months, then we should stop it. So it is something that you can maybe have immediate benefit, and then you can see increased benefit over time as well.
Mm-hmm. Sorry to have interrupted you, Karen. Do carry on.
We can go on any tangents. There are lots to talk about.
I was hoping you were going to tell us about mold, because that is a big issue for many of our members.
Oh, yes. Well, I do. These days, the farther I get into the rabbit holes of understanding all of the factors that affect the brain that I never learned in psychiatry, infections and immune triggers are turning out to be really of great importance. And mold is something that that is a huge trigger for the immune system and the brain. It's not the mold itself. The mold releases mycotoxin spores, and those mycotoxin spores get in people's systems when they're exposed to the mold, and it triggers an immune response. And we know that about 24% of people have genetics that make them sensitive to mold illness. So anybody that's exposed to toxic mold will get sick. But if they remove themselves from that situation, their immune system clears the response from the mold and they're fine. But about a quarter of people get exposed and they just cannot clear those mycotoxins, and they keep circulating and triggering somebody's immune system. And so it's the immune response with all of that inflammation and cytokines that is, causing the physical and mental symptoms that we see. So LDN is one of my, adjuvant treatments with mold, because I'm trying to support the immune system, while I'm trying to, help that immune system and detoxification system clear the mold. So it can definitely be a helpful adjunct with mold illness, both from the immune perspective and from the psychiatric emotional perspective, because when people are suffering from mold illness, it definitely is toxic for the brain and is igniting all kinds of symptoms in people's brains. I actually do a lot of work with Alzheimer's and dementia and mild cognitive impairment, and we're finding more and more that triggers like mold and Lyme and other brain-based infections are much more important in the development of dementia symptoms than we ever knew. We've come to know that there's a big vascular component with dementia, and so your blood sugar control and your lipids and your inflammation, all of those factors are definitely important in developing dementia, but I'm seeing even young people in their 20s that have symptoms of dementia that turn out to be from mold-related illness. So LDN is definitely part of my toolkit in working with that illness.
So for people who've got Alzheimer's or dementia early stages, would you recommend that they start LDN as early on as they could?
So, I guess it would be what would be the factors with the dementia. In some ways, with dementia, obviously you want to move as quickly as you can, and not have processes develop. And so, if there's any hint of immune diathesis causing and contributing to that, if there's any infections, then yes, I would say do that. I have one of my dementia study groups with Dr. Dale Bredesen, who's published a lot about a functional approach to dementia, and now is training other clinicians in his approach to reversing dementia. In the study group that I am working on with him, we definitely have had some discussions about the use of LDN. And, for me, I like to know that I have a target. So, and usually there's multiple targets, but, if there's immune, if there's pain, if there's infection, if there's mood, then those are all potential reasons. So I definitely think that we're going to be probably seeing more use of LDN with cognitive impairment, because cognitive impairment so often is from immune illness and infectious illness, where it's helpful to support the immune system. The infections, so, Lyme disease and the co-infections with Lyme are another area that LDN is, definitely put that on first line is, what I think, because what happens with Lyme disease is it shuts down the immune system, right? It's trying to suppress the immune response so that the immune system cannot detect and clear the Lyme spirochetes. And so LDN then becomes a mechanism to help support the immune system so that it can detect and clear that infection. So that whole spectrum of illnesses, I also think is another use for LDN. I've had some discussions with one of my friends and colleagues who works with PANDAS, and that's the Pediatric Autoimmune Neuropsych Disorders. One of those names, I can't quite always remember all the letters, but typically it's been reported in children that they'll have an infection, most often strep, but it can be caused by mycoplasma. It can be caused by other infections that trigger that child's immune response, and then the immune system starts attacking the brain, and these children can develop pretty acute onset of severe obsessive compulsive disorder and tics and behavioral problems. And I had recently worked up, I don't normally treat children, but I worked up a 12-year-old because of a family connection for his PANDAS, and discovered, that he had an infectious source with active mycoplasma. So I referred him to this colleague of mine, and I had started that child on LDN, and my PANDAS expert friend said that she definitely was using more of that with her population as well.
That's wonderful. Well, we'll just have a quick break and we'll be back in just a moment. Today's show sponsor, Care First Specialty Pharmacy. They are leading compounders of LDN and other custom treatments, servicing patients in over 18 states coast to coast. They are widely accredited to provide you with the highest quality demanded by the industry and the expert service you expect. To learn more, call 844-822-7379 or visit cfspharmacy.com. The LDN Health Tracker app, called My LDN, is available free for Androids, iPhones, Macs, PCs, iPads and notebooks. The app allows you to keep track of all your medications, pain levels, sleep, quality of life, etc. You can print out graphs and charts to take to your doctor. Full details on the LDN Research Trust website. You can keep a journal so you won't ever forget anything again, and set alarms. The app is free and all your information is held securely and anonymously. By using the app, you'll be taking part in the world's largest LDN survey, anonymously. Any questions, please email me, linda@ldnrt.org. Welcome back. I wonder if you could tell us a bit more about LDN and infectious diseases, please.
So, the idea of infectious diseases is that we should have a healthy immune system that should kick into gear and help us to clear infectious diseases. So we have, a beautiful design that is supposed to work. For some kind of acute infectious diseases, those are places where, a short course of antibiotics may knock things out, and that will take care of things. The problem that we get into is with the people that have chronic infectious diseases that are chronically triggering their immune system, and those are some of the kind of patients that I see, and they come in when I take their symptom history, they have, 20 or more active symptoms that are troubling them. And you look at this and you know that a traditional doctor will look at that many symptoms and say, oh my God, you're neurotic, you're a psychiatric patient, you need to go see the psychiatrist. Well, I am the psychiatrist, so I get, at least from my perspective, I can say, you have all these symptoms. This is not in your head. It's in your body. There's something happening in your body that is triggering the symptoms, because people will tell me, I'll do whatever if you want me to take, psychiatric meds, whatever. I just want to get well, But of course, the answer for me isn't giving the psychiatric meds, because those don't get them well. I may use psychiatric medications in the short term as a Band-Aid. If people are bleeding, they need a Band-Aid, and if, a medicine is going to help them, I have, no qualms about using that, but that's not the end point for me. That's just a Band-Aid while I try to figure out what is causing this chronic infection and how can I support their immune system to clear that infection. So, as I've mentioned, the LDN definitely is one part of the toolkit to start helping support the immune system, so that and we haven't talked about this in the conversation, but we've talked about that the LDN blocks your opiate receptors, and it triggers an increased response in your opiates. And the connection of how it works with the immune system is that those opiates bind to your T regulatory cells, and the T regulatory cells are a component of your white cells, and the white cells are our immune cells that help fight off infections. So the cascade is a little magic. Once it binds to those T regulatory cells, the increased opiates, but the net result is that it can support those immune cells to start functioning more optimally and can help particularly settle down the immune response that's attacking people's own tissues in their own bodies and causing immune symptoms. But with the infections, it's still an immune response. The body is triggered to fight off some chronic infection, and it can be a low-level infection. Certainly a lot has been written about dental infections. This is a really tough area where people have a root canal because they've had an infection in a tooth, and the dentists take out the roots and they fill them up with the material, and they say, okay, this tooth is cured. But what I've learned is beyond those roots, there's miles of microtubules, and the infection can get into those microtubules, and maybe it's a low-level infection, but it can be enough to keep turning on someone's immune system. So the immune system still reads that as infection, and it stays chronically turned on to try to take care of that infection. And some people with immune disorders just won't get well until they pull those root canal teeth because it's triggering this chronic infection. It's a little harder to know and decide that for people. But the important fact here is any kind of chronic infection, even if it's a low-level infection, can be triggering your immune system, which then can cause any kind of immune systems it's why we see people come in with so many symptoms all over their body that are seemingly unrelated, but those can be immune reactions that are happening.
Mm-hmm. And I know that you took part in the Lyme disease documentary. Now, from my experience of people with Lyme, exactly what you were saying, they have so many different symptoms. They go to the doctors, and even though these people are really obviously very ill, unable to move, function, the pain, cognitively, etc., and the doctor says it's all psychological, it's in your head. And how devastating when you feel that low to be told it's in your head, and being offered, antidepressants and things. It's really difficult, isn't it?
It's the worst. It's such a devastating situation, and and the whole notion of a somatization disorder is something that you have somatic or body symptoms, but it's really psychiatric, and it's in your head, and it's for some neurotic reason. That whole that whole diagnosis to me needs to be ripped out of our psychiatric manual. It is so devastating. So my first job is to have people believe that they can get better. Mm-hmm. Because when the doctor says, okay, it's all in your head and you're just going to take these medications, just like with cancer, if you have cancer, the doctor says, okay, well, you have a 25% chance of living. Well, all you're going to hear is you have a 75% chance of dying. And, when the doctors make these pronouncements, it's like a witch doctor in the jungle who shakes a bone at the villager and says, you're going to die, and they go off into the jungle and they die because they believe that, right? Mm-hmm. So the first that really I have to do is empower people and get them to believe that they can get well, and that these symptoms really are of physiologic nature, and that once we can, find all the causes and support their nutrition and support their immune system, that they can get better. I think that's a devastating thing. And I would like to tell you about a case with Lyme that had, this person was my friend. She was a really good friend of mine, and she was very ill from Lyme and Babesia, and she was quite cognitively impaired. She could hardly figure out how to feed herself or get dressed. I mean, it was really eating up her brain and her body. And I sent her to see one of my friends and colleagues who is a Lyme literate doctor. I don't consider myself, a Lyme specialist out of necessity. I'm diagnosing it and, working with the immune support, but I'm not an expert with any of the antibiotic treatments. And so I sent her to see my friend, and he put her on an herbal regimen for her Lyme and Babesia. And I suggested that we start her on LDN as well. And the Lyme doctor said, well, I don't know that we should do that because we won't know what is helping her. And I said, who cares what's helping her? We just need her to get better, right? So we put her on the LDN, and I say literally 4 weeks later, it was like a switch went off, and bang, her brain came back, her functioning came back. It was quite dramatic. So in that case, I mean, she was doing other things, obviously. She was taking, some herbal protocols for the infection, but typically those herbal protocols take, months to years to clear infections. In her case, I felt like adding the LDN just gave her immune system enough of a jump start that it was able to help her clear that infection. I don't always see it as dramatic as in her case, but it was very dramatic in her case. Just like a switch went off and her functioning returned. So I definitely think, with Lyme and with chronic infections, it's kind of a no-brainer to at least try the LDN to see if it can provide some additional support for people.
Mm-hmm. Well, I would have to say we've just about run out of time. We'll have to have you back. This has been very interesting. I've been quite quiet and I've been taking it all in. I have really learnt a lot. And if any of the listeners out there are in your area, how do they get hold of you? How do they make an appointment?
Well, my website has the information. My practice is called Bay Area Wellness. So the website is bayarea.wellness.net. And I also have, for people on Facebook, if, let me see, what is my Facebook site called? It's called Bay Area Wellness - Functional Medicine Psychiatry. And I just try to post interesting articles that are relevant to the brain and the immune system on there. So people are welcome to check that out. I like to go back and read my own articles on there from time to time because it's fun to find, interesting research that gives us hope and help for various ideas that people are suffering from. I also want to say probably some of your listeners are connected in, but there's an LDN Research Trust Facebook group, and there's some other Facebook groups regarding LDN for other specific conditions. And I know that was really helpful for me in my early days of learning more. It's always helpful to read other people's responses and questions. So I think those are good resources for people to learn more. But of course, your website, ldnresearchtrust.org, is the first place I send people, because you've done such a great job of curating all the studies and the data and the information. So I just want to thank you for all that you do. I know you work so tirelessly to help people to understand the benefits here, and I certainly have benefited from, learning at your feet for, the ways with all of this for all of us. So thank you so much, Linda. Really appreciate you.
Well, it's nice to be appreciated. Thank you. And as you were saying about learning from other people's experience, I think I have nearly 600 Vimeo videos where I've interviewed patients, and even the doctors have found it really interesting, especially the not such common conditions where a patient is giving the story in their own words and you can hear the emotion in their voice. It adds something to it other than just reading a testimonial. So I'm very grateful to all those people that have shared their stories with us. But we will definitely get you back.
For people, right? The understanding that people can really get well and get better, that's the first step, to hear those stories. That empowers people. So that's a wonderful resource that you have.
But you do feel when you've got a chronic illness, rather when you're really down and you're feeling really ill, very isolated, and you don't really have hope for a better future sometimes. And I think we all need a little bit of light at the end of the tunnel to show us the way. So keep up the good work, and thank you very much.
Well, my pleasure. Thank you for including me.
The LDN Research Trust has its own forum, which can be found forum.ldnresearchtrust.org or via our website. The forum is divided into sections, so it's easy to navigate and find what you're looking for. You can share your experience, ask questions, keep a journal, etc. Unlike Facebook, the posts are always easy to find and don't get buried. We have a private medical professionals only section. To find out more, please email me, linda@ldnrt.org. Today's show sponsor, Care First Speciality Pharmacy. They are leading compounders of LDN and other custom treatments, servicing patients in over 18 states coast to coast. They are widely accredited to provide you with the highest quality demanded by the industry and the expert service you expect. To learn more, call 844-822-7379 or visit cfspharmacy.com. Any questions or comments you may have, please email me, Linda, Linda, @ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.